when I first heard the Connecting for Health framework, I'd read it, but when I heard David present it, the notion of consumer access services and what does that mean, came to mind. And I think that there is a provocative opportunity to not just react to what's being put out there in the marketplace or in partnerships, but to proactively offer something forward. And say, this is the kind of system, this is the kind of prototype that would work. And I think this notion of universal usability and coming up with solutions that not only transcend a number of disability conditions, but also just represent good design, period, is an opportunity, is a forward-looking opportunity that can be had. I think that today we heard that the PHR system world is not just a private sector world. I think we had previously heard a lot, and rightfully, that the marketplace is out there, that there needs to be incentivized, that type of thing. But the numbers that you heard today in terms of, $300 to $500 billion in terms of public sector funds from Social Security, Medicaid, Medicare, et cetera, is a huge amount of funds. And Steve's point, of course, would be that the money that's spent in determining how those funds get used is also an important pivot point. So there's a clear public sector mandate and possible efficiencies through PHR, which you're not quite seeing playing out in the marketplace. So there is a public sector situation going on, which can also show public sector return on costs expended. So I think that that's out there, and I think that's been established, and I think there's some numbers that are being developed that really substantiate that. On the know the user, that's our mantra at the Case Center, user-centered design, and trying to figure that out. I would observe that often it's the unintended, there are negative unintended consequences, but there are also positive unintended consequences. And maybe I'm an optimist, I look for the positive unintended consequences. But I'm reminded of the MeVia program, and I was speaking to David about this, which is for migrant farm workers in California, where they develop a personal health record. And it's done, a very good service for migrant families that work the fields up and down California so that people can know who they are and what kind of health conditions they have. Well, one of the unintended positive consequences was this card they gave out as part of being part of the MeVia program. And it became an identifiable card that people could use in the library and this and that, and it actually gave the program traction. You couldn't have predicted that email would give, the internet the traction it has. And so all I'm saying is that as one goes forward in thinking about personal health records and how it can solve real problems, and you didn't get to hear June's full-blown articulation of how it can solve specific problems, and I'll tell you, it's riveting. And in doing that, there can be positive uses and thought patterns about relieving unnecessary hassles and things like that. And I think our job as researchers is to go out and help discover those uses that have traction and report those forward, because that's a motivator to do it. So I think there's more that can be done there. Of course, when Fred talked about convening the forum, I felt the bullseye right on me there. But it's a great suggestion, and we are trying to do our part to facilitate the coming together of consumers, stakeholders, and IT folks in a policy-relevant way. So among the items we'll be working on, we'll certainly follow up on that. Beyond that, there's a long list of things that I have to digest and think about, and we will report back to this group by way of a summary as to that short list. And we do invite you to consider yourself part of this nascent, emergent working group to fashion through solutions to this, as well as identify situations. That's why we've done it. That's why we've done it here in Washington, and why we will continue to forge this path and look forward to working with you. So with that, we're adjourned.